Okay, so good afternoon, everybody. It's 4 p.m. We started doing a full body liposculpture, everything upper back, lower back, arms, thighs, and of course, upper abdomen, lower abdomen, flanks. At this point, we're starting to do a fat transfer. So, after doing a full body liposculpture, we're doing a fat transfer for a Brazilian butt lift, and also we'll do a natural breast lift. So, we'll let you follow us in this step by step. Our patient here is awake. Can you give us a thumbs up? Yeah, perfect, thank you. All right, great, she'll put her hand down and we'll get started next, okay? All right, so we're done putting the fat. So again, the butt configuration will differ from woman to woman, depends on the width, of her waist. So our patient have a wide pelvis, the pelvis bones come to here. So that's why we have a wider shape, but we created a nice perfect curve on the side. So when she puts a dress, this is like a beautiful curve on the side, and it's also proportionate to the back part. So we don't, our patient wanted not a very large butt, so there's no reason to go any higher at this point because this is like within, her instructions. And I think it matches her body and it matches the waist. We were able to make the waist look smaller by bringing the curve outside. And we're gonna next ask the patient to turn on her back and we're gonna start doing the natural breast lift after the liposuction. So now we're gonna get ready to do the breast lift. We're gonna do the breast without creating any holes. We're gonna just use a very small hole that we have in the belly button. So we have a long cannula and we'll transfer the fat all the way up here. If you see, our patient is beautifully sculpted. All the lines on her muscles are showing very clear. Her central line here, and this is also on the same side. So like the abdomens in a woman looks nice and long. We try not to cut them into a six-pack like a man, but for men, we create the shade and the lines of the six-pack. But in ladies, unless they ask for it, we try to make it look athletic and natural and more of a straight look. So in a few minutes, we'll show you the breasts. If you can see, she has good breast. It's a good spot. It's not, doesn't need a lift. It just needs size. So we'll show you this in a minute after we put the fat transfer. So if you see, we have the cannula, and my technique again to minimize holes. So all this here is done only with 1, 2, 3 holes, all the sculpture of the front, in addition to the breast lift. So our patient will have a very fast healing, and we're gonna go a little higher in behind the breast tissue, and we'll start putting a little bit of the fat, and you'll see the size of the breast filling up as we go. And we will continue until she have a perfect size breast. We'll show you at the end in a couple of minutes. So our patient is completely awake. Are you able to give us thumb up with this hand? Thank you very much. Okay, all right, everybody. Okay, so now all the surgery is complete. So again, in summary, this is all done in one day, only in Superior Medical Center. We did complete liposuction, abdominals, arms, complete back, upper back, lower back, flanks, very nice waist. We did the thighs inside, trimmed the proper shape of the thighs outside, and then we did the fat transfer. We did a Brazilian butt lift, natural fat, and also the breast, natural breast. Our patient went almost from size like B. At this point, we're like at a D to D plus, and that's all natural fat. And at this point, after we're done, my assistants will do the cleaning of the patient. They're gonna use the bandages. Again, there is minimum number of holes that were done in this whole procedure. So the recovery, tomorrow morning, our patient will be able to drive herself here to get her follow-up. First day, we do the follow-up in around like 16 hours on the following day, and the patient will be able to drive herself. Tonight, she will sleep with zero pain. And remember, the most important thing, we do this whole body sculpture and surgery, Brazilian butt lift, and the natural breast. All this is done, no general anesthesia. No general anesthesia. This is all done under local anesthesia. You know, and if you look at our patient, she's very comfortable. Are you having any pain at this point? No pain, comfortable? Okay, and tonight you're gonna sleep like a baby, like no surgery. You'll be very surprised. Tomorrow morning you'll wake up, no pain, and you'll be able to drive here. Thank you, everybody.